and other stakeholders. Just like to confirm one thing, am I audible?
Yeah, very much audible, please.
All right. May I start?
Yeah.
Yes.
All right. Good afternoon on behalf of the district administration, Kamrup Metropolitan District, which is actually the city of Guwahati, which we know as the gateway to Northeast India. हमारा जो project अभी फिलहाल that we are showcasing for this Scotch Awards is the response to COVID. Now, the COVID pandemic caught all of us unaware, and the same was the case in Kamrup Metro also. You know, when the COVID first hit us, Kamrup Metropolitan District was at the forefront of the entire pandemic because Guwahati being the gateway to entire Northeast India and being the capital and the largest city of Assam, we had a lot of people who were coming back from different parts of India. We were also having the best of medical infrastructure in Guwahati. So all across the state, all the COVID cases, the critical ones were shifted to Guwahati. We made makeshift stadiums into hospitals overnight, and we were trying our best to fight the pandemic. Now, the Honorable Chief Minister of Assam, Dr. Himant Biswa Sharma, who was at that point of time the health minister, was at the forefront of this fight, meeting COVID patients, guiding the policymakers, bureaucrats, frontline workers, healthcare workers. And together we put up an united fight against COVID, which has won us good laurels. In Kamrup Metropolitan District specifically, following well-established medical canons, we executed the triple pillars of tracing, testing, and treatment. And along with this, after the COVID vaccines were made available to the government stakeholders, we have initiated a very strong and innovative vaccination program, which has allowed us to vaccinate 10% of our district population. And then there are certain unique initiatives also which have come out of this entire exercise. ये जो हमारा experience रहा है, इसके मंथन से 2-3 unique innovations हम लोगों ने emerge करवाया, which is the crux of this entire presentation. Mainly contact tracing and surveillance, disposal of bodies of people who have passed away because of COVID, and lastly, a very unique vaccination model. So the first pillar that we're talking of is contact tracing and surveillance. Now, contact tracing is a pretty well-established medical mechanism, but how we have innovated here, I'll be focusing mainly on that. Now, Guwahati being the main hub of entire Northeast India, we were witnessing the highest case loads of COVID positive patients. We were also at the forefront of receiving COVID positive patients who were coming from different parts of the state also. Now, in such a situation, Guwahati being such a densely populated city, it was very important for us to realize that we needed to trace the positive patients, isolate them, and also we have to trace those patients who came in contact with the positive patients so that the chain of command can be broken. Now, on an average, it was seen that per positive patient, around 15 people would be contacted if they were not quarantined immediately. And those 15 would lead to another 15 into 15 to 25, and the chain would keep on going. Already at a point of time, we realized that we need to devise a very strong contact tracing mechanism and a surveillance mechanism. So those who came into contact with the positive patients immediately were identified by a bevy of workers. We have a very strong workforce here of multi-purpose workers and healthcare professionals. So let's say yesterday in Guwahati, for example, let's say we have done 20,000 tests and we realize that there are 100 people who are positive. So by today morning, we get a list of all the positive patients with their addresses. In the morning, in the collector's office where I'm stationed, we have a meeting with the entire team. Every morning we have a breakfast briefing. We review the progress of the previous day's work, and for the current day, we give the targets. This team then immediately fans out into the city. These teams are assisted by the circle level officials, which we also call as Tehsildar in other parts. There are Thana level committees, police level committees. So there is a micromanagement of tracing. Upon tracing these people, these teams go and isolate them in their respective households. They force them into quarantine based on their consent. Medical kits are given. And if these people, let's say, require institutional quarantine, if they need to be shifted to a hospital because of old age or comorbidities, the shifting is done then and there. The most interesting part is that, as we see in the slide, there is a backend data management. We have a very strong backend data management team, which works round the clock, 24/7 uninterrupted, to collate all the data pertaining to COVID positive cases. If we see very clearly from 12/4/2021 to 6/09, just a few days back, we traced almost 56,000 positive cases, and against which ये 56,000 cases है positive patients के, against which we traced around 1,33,000 people, family members, people who might have come into contact with them. Now, because of this, if you see, Kamrup Metro has been faring very well in the COVID management. We have not had any shortage of hospitals. We have not had any shortage of critical resources. And overall, the infectivity and the virulence of the virus has been credibly contained because of a very strong contact tracing and surveillance mechanism. Our additional commissioner of the Guwahati Municipal Corporation, Pulak Mahanta sir, he has been managing this vertical in conjunction with the district administration and other healthcare workers. The second point, or the second pillar, is perhaps the most unique innovation we have evolved in the COVID response mechanism. That is the dead body disposal management system. हम सबको पता ही होगा जब पहले COVID आई थी 2020 में, and when the first wave of the unfortunate people who died because of COVID, a major problem with the administration and the civil society was regarding the cremation of those bodies. Because first and foremost, the crematoriums which were there, वो लोग allow नहीं कर रहे थे कि COVID bodies को वहाँ पे हम लोग cremate करें. There was a natural fear and panic. The workers of the crematoriums, who were normally assigned for such works, they were scared to work in this. And most importantly, the relatives, the people, the family members of those who had passed away, already they were broken by the grief of losing the loved one. And additionally, there was the stress of cremating the dead bodies in a proper manner. Excuse me. In Kamrup Metropolitan District, we evolved a very unique system for smooth and seamless disposal of dead bodies of those people who have died because of COVID. Now, यहाँ पे होता क्या है? On a daily basis, every day at periodic intervals, maybe in the morning, maybe in the afternoon, in the evening, we get a list of those people who have passed away because of COVID in the institutional quarantine or maybe at homes also. Generally, घर पे नहीं होता because even if a person is staying in home quarantine and his condition deteriorates, we immediately arrange for shifting. हमारे जो multipurpose teams है वो arrange कर देती है. So 99.9% of the COVID deaths have taken place in the institutional quarantine, that is the hospitals. So from the hospitals, we get a list of those people who have passed away because of COVID. And we have to accord permission for the cremation. So our additional district magistrates or the district disaster management authority, they accord the permission for the cremation. And we have multiple teams stationed in our office who then go out into the different medical institutions where the dead bodies are there. They are then transported to our designated cremation sites. हमारे जो designated cremation sites district administration जो manage करती है, they are sanitized regularly, healthcare workers are screened regularly, they are given testing regularly, proper PPE kits are given. And when the body is being transported, the family members of, let's say, a person who has passed away is immediately informed कि आपके परिजन का या आपके relative का cremation इतने बजे यहाँ पे होने वाला है, you kindly be there. So from a distance, we allow them to observe the rituals, and following all COVID protocols, the cremation is done. Agar koi leftovers rahe, if there are some belongings like ornaments or something which are there with the patient, it is handed over after due sanitization to the relatives. And this cremation process is completed without charging a single penny from the family members. Most importantly, there is no need for any intervention on behalf of the family members. For example, if someone's relative has passed away, he does not need to come and run from pillar to post, get permission, file any forms, nothing. It is entirely an autonomous process which is carried out on behalf of the district administration. And this is our tribute and our support to those people who have lost their loved ones due to COVID. Already it's a very harrowing experience. And in this hour of grief, we try to extend a human touch, a sensitive touch, by at least providing some relief in ensuring a proper and a dignified cremation or a burial for people of the Mohammedan community, as the case may be. Now, just to give a small estimate, from January till date, we have carried out the hassle-free cremation of around 1850 dead bodies till now. We have the entire database, which can be inspected upon will. And this has been going on seamlessly 24/7 without any break. Be it the Bihu festival, be it floods, be it urban floods, anything. It has been going on 24/7 with no backlog or no leakage or any sort of message from this part.
Sorry to interrupt, sir, but please keep that as we have only 2 minutes left for the presentation.
Yes. The third and the most important part is the vaccination via the electoral model. Now, normally we have an electoral model जहां पे हमारे पास बूथ लेवल ऑफिसर होते हैं जो इलेक्शन कमीशन का मॉडल है. तो हम लोगों ने कामरूप मेट्रो में वी ऑलरेडी ensured very high levels of vaccination, but we decided कि let us not leave any leakages. So हमने ये बूथ लेवल मॉडल को वैक्सीनेशन मॉडल पे हमने कन्वर्ट कर दिया. So what we did was that we instructed all the booth level officers to go and conduct a door-to-door survey. We empowered them to go and do a door-to-door survey and to find out if there is any eligible citizen who's left out from vaccination. And then through special vaccination drives, the BLOs, the booth level officers, they mobilize all the nearby people because unke booth mein jo bhi citizens hai, they're very much, aware of them. They can identify them. And we ensured almost 10% vaccination of the Kamrup Metropolitan District. As of now, in fact, today's figures, if we try to quote today's figures, we have 18,76,000 vaccinations done in Kamrup Metro, out of which around 11.6 lakh is the first dose. According to the census, हमारा metro का population around 12.5 lakhs है, as per 2011 census. ये थोड़ा बढ़ेगा, but considering the fact that 18 years and above are eligible, जो voters है वही eligible है practically right now for the vaccination. We have completed 10% vaccination of the entire district. That is a major initiative for us. And what is the most unique thing about this nomination is this, Kamrup Metro, we witnessed the highest caseload of COVID cases from all across Assam. With limited infrastructure, with limited resources, we have managed to innovate and improve upon our existing models and create a new paradigm in COVID management. And the Assam model of COVID management has been really appreciated across the media, and the public has been responding to it very strongly in our social media accounts. You can have a look, and we have been able to reach out to every citizen. The main challenges were that, being in the government, we had limited resources, both in terms of manpower and other resources. However, bringing in civil society and innovating upon the current models, we tried to overcome all the bottlenecks and we tried to forge a robust response to this pandemic. Most importantly, the excellence and innovation, which has come has really been helpful in giving public health the main focus in administration as compared to development or something. And we have been able to rise to the occasion in Kamrup Metro, providing the best of services and a humanitarian touch towards citizens. And these initiatives can be scaled up in other parts. Like, to give just one small example, on an average days, we have reached out to almost 1,200 households for contact tracing. So based on the necessity, based on the number of cases, we can increase it. For vaccination and testing, where people struggle to reach even 10,000 figures, हमने एक दिन में 25,000 vaccination and 25,000 testing करवाया at a time when the awareness for vaccination and testing was not very high, through our interventional model and through direct grassroots intervention. Thank you.
Thank you. ये बताइए सर कि ये जो आपकी डिस्ट्रिक्ट है, whatever initiatives you have taken, is it only for special for this district? How about your other districts? Any idea? Or is it the type of initiative which you have taken in these districts, other districts have not taken this in your state?
Sir, I would like to say that yes, other districts have also taken initiatives, but initially the main driving point and innovating these initiatives were taken by Kamrup Metro.
Because what I find is most of the the initiatives which you are indicating, the 3 initiatives, I think others have also done it more or less. Maybe you have done it more systematically, but this is how it has been, efforts have been to see that contact tracing is there, disposal of dead bodies is proper, and vaccination. I am happy to note that 100% vaccination you have done, but that is the first dose. Second dose is just I think 6 lakhs or so you have done.
Yes, sir, but second is mainly because of the people for the waiting period. There is a waiting period in between.
I know.
So we're waiting for that.
Only this discrimination, when you say you are keeping into mind burial part also, for Muslims or other religions, those who don't criminate, so how that was handled?
So the same was also, sir. We have हमारे यहाँ पे कब्रिस्तान, for example, है, sir, and we have like a burial ground also. So peoples of the Abrahamic religions or the Muhammadan faiths, they are also carried out accordingly, sir. वो as per the religious denominations carried out.
कुछ लोगों की ओर से ऐसा resistance था कि they wanted to be with the departed person, body, and maybe some rituals to perform some rituals, or everyone agreed ki yes, you can dispose of, just for my feedback.
Sir, very frankly, agar bole, sir, people after witnessing the death of their loved ones, they realized what a dangerous virus this is. So they used to pay the respect from a distance, and they were very cooperative, sir. I must thank all the citizens because they really work hand to hand with us. कभी हमको untoward situation face करना नहीं पड़ा sir इस बारे में.
अच्छा, अब लास्ट है, आप कोई एक फैक्टर बता सकते हैं जो आप समझे कि इस वजह से हम ज़्यादा सक्सेसफुल हुए, क्योंकि इनिशिएटिव तो बाकी लोग भी मोर और लेस लेते हैं ये सब इनिशिएटिव.
Sir.
Single important factor you would like to indicate which makes you feel that you should get award from Scotch?
Sir, I think one major thing, if you compare Assam to the rest of the country, I mean, as of now, you may not really count us, that high in terms of healthcare indicators or in terms of resources. But
No,
one
I'm only comparing you within the state.
Sir, yes, sir. So what I'm saying in Kamrup Metro, I think the biggest changing factor or the catalyst has been that, the administration, the line departments, the municipal corporation, all of us have been working under one unified banner in a conjoined manner, irrespective of rank or hierarchy, sir. That is the only reason why it has worked so well.
Okay. Thank you.
Right, sir.
Thank you. No questions.
Thank you, sir.
Thank you. No questions from my side as well.